All right, folks, so we're going to talk about chapter 24, your trauma overview. So this chapter takes bits and pieces from all of the other trauma chapters that we'll cover, kind of compiles it into just a real brief overview. That's the best word. All right, so traumatic injuries or traumatic emergencies occur as a result of physical forces applied to the body. Okay, so the human body can only withstand so much force being applied to it before things start to go awry. Medical emergencies occur from an illness or condition not caused by an outside force. So that's why, you have your medical assessment sheet, you have your trauma assessment sheet, you have to approach your trauma patients and your medical patients in a different manner. Are there times where the two might blend? Absolutely. But when we talk about it in a systematic approach, we need to think about it in two different worlds, okay? Index of suspicion, so your awareness for potentially serious unseen injuries. Okay, so this is where we start to look at, mechanism of injury. What are we dealing with? Is this a stabbing? Is it, blunt trauma from a motor vehicle accident? Is it blunt trauma, or, is this a secondary injury from, a blast, an explosion? Because not everything is going to be the huge puddles of blood, the exsanguinating, life-threatening bleeding, or the mangled extremities and things like that. There's going to be times where patients are going to be seriously injured, and it's not going to be, visible right immediately. It's not going to be right in front of us at the moment that we make patient contact. So we have to start sifting through, looking at all the components of what we're dealing with and go, well, this happened. I'm really worried that this might be going on, or we might, develop, XYZ, whatever the circumstances are. Okay. All right. So we talk about energy and trauma. So traumatic injury occurs when the body's tissues are exposed to energy levels beyond their tolerance. Again, the human body can only withstand so much before things start to go awry. Your mechanism of injury describes the forces acting on the body that cause the injury. Okay, so again, this goes back, is this a stabbing? Is this a shooting? Is it a motor vehicle accident? What kind of forces, what kind of energy have been inflicted on your patient? Okay. All right, so your three concepts of energy. So you have potential energy, kinetic energy, and energy of work. So work is defined as force acting over a distance. Okay. So all this stuff has to be thought about. You go back to physics and how energy works. It's just those simple physics. What is the potential here? So you look at, rate of speed. Was this patient hit in a T-bone style accident? Were they rear-ended? All these types of things have to start being added up to figure out, again, how much force was applied, how much energy was involved here, and what potential injuries are we going to see. Okay, so these are forces that bend, pull, or compress tissues beyond their inherent limits. This is where we result in injury. Okay. All right, so kinetic energy is the energy of a moving object. Okay, so you can use the equation, but I just like to think about, energy of a moving object. How fast was the vehicle going? Okay, that plays into your mechanism of injury. Potential energy is the product of mass, force of gravity, and height. So mostly associated with the energy of falling objects. Okay, so this is where you're going to look more at, things like falls from a significant height. You have someone that falls off of a roof 20 feet, lands on concrete. The potential energy and the potential mechanism of injury there is very significant. Okay. All right, so different mechanism of injuries produce many types of injuries. So non-significant injuries may be an injury to an isolated body part. So, you have that deformed, obviously broken ankle, or, a deformed, obviously broken wrist, fall without the loss of consciousness. And I will say that, I don't know that I would really put that into a non-significant injury category. You need to look at, the distance of the fall, the surface that they landed on, the age of the patient. Are you dealing with a child? Are you dealing with a geriatric patient? There's a lot more factors that you need to consider in that situation. Significant injury, so injury to more than one body system, or we call this multi-systems trauma. That's where things can become rather complicated, and it makes it hard to manage the patient because you're putting out one fire and the next thing you know, you have another fire and then you go to extinguish that. And then this other problem catches fire again, and it can become a mess for you as an EMS provider, okay? So falls from heights. So, we typically like to say anything that is 1.5 times your height. So say you're 6 foot tall and you fall from a distance of 9 feet up in the air. We would consider that to be significant. They talk in here about, fall from 20 feet. Yeah, that's absolutely significant. So it doesn't take a person falling from much greater height than their actual height for it to be considered significant. That's where you have to do a good assessment. What did they land on? Did they land in the grass or did they land on concrete? Did they land on their head or did they land on their feet? So you have to decipher through the situation. And then vehicle crashes. What's your rate of speed? Were they restrained? Were they wearing their seatbelt? Did the airbags deploy? There's lots of things that go into those factors. All right, so blunt and penetrating trauma. So blunt trauma is a result of force to the body that causes injury without penetrating the soft tissues. Okay, so someone gets, whacked in the abdomen with a baseball bat. That would be a good example of blunt trauma. Penetrating trauma causes injury by objects that primarily pierce and penetrate the surface of the body. So shootings, stabbings, things like that would fall into that category. So blunt trauma results from an object making contact with the body. So again, this could be somebody's whacked in the abdomen with a baseball bat during an altercation, striking the steering wheel with your chest in a motor vehicle accident. So there's multiple scenarios where you could be dealing with blunt trauma. Motor vehicle crashes and falls are the most common. Be alert to skin discoloration and pain, okay? And then maintain a high index of suspicion for hidden injuries, okay? So, you have that person that's whacked in the abdomen with a baseball bat and you get there and initially when you do an exam, it's just red, and you get them loaded in the truck and they start to, tell you they're having all this pain and they just don't feel well. And next thing you know, the abdomen starts to bruise and it starts to become distended. You have to really have a high index of suspicion in that instance, for internal bleeding. This rapid transport, treat for shock, load and go kind of patient. So those types of things are the things you're going to be looking for. All right, so vehicular crashes. So a crash consists of 3 collisions. Okay, so examples here, a car against another car, a tree, or an object. So by assessing the vehicle, you can often determine the mechanism of injury. Okay, so you pull up on scene and you look at what's going on. You get that, you even get that bird's eye view as you're rolling up and go, okay, this is what I'm dealing with. Okay, so that's your first collision. Your second collision, so the passenger makes contact with the interior of the vehicle. Okay, so again, this is gonna, were they restrained? Did the airbags deploy? Were their headrests in the proper positions? All those types of factors start to play in here of how significant this part of the crash can be. Common passenger injuries include lower extremity fractures. So people, slide out of the seat or, down and under the dash, or you've got interior compartment intrusion into the cab of the vehicle. So, you start to get those, ankle fractures, tib fib fractures. It hit them in the knee and shoved their femur, and fractured their femur. Just depends on what you're dealing with. So flailed chest and head trauma are some other common injuries that we may see. And then the third collision here, the passenger's internal organs against solid structures of the body. Okay, so internal injuries may not be as obvious as external injuries. So, the good example in the picture here is, head hitting the windshield. And this is going to be something that, you arrive on the scene of a motor vehicle accident and you have starring of the windshield. And the patient tells you they hit their head on the windshield. That is something that I always consider to be significant. I'm going to make sure I do a good assessment on that patient, do a good neuro assessment. I'm going to be watching and being concerned with a head injury, looking for signs and symptoms, doing all the things to try to combat all the bad effects of a head injury. So those are the things you have to look for. So internal injuries may not be as obvious as external injuries, but are often the most life-threatening. So remember that, okay? That's why it's so important that we do a good initial assessment. You get your patient trauma naked, and then you do a good secondary assessment and good reassessment on all your significant mechanism of injury trauma folks, okay? All right, so frontal crashes. So evaluate supplemental restraint system. So, again, were the occupants, wearing their seatbelt? Were they wearing their seatbelt appropriately? Did the airbags deploy? All those types of things. So despite airbags, suspect injuries to extremities and internal organs. Okay, so you have to remember each stage of the collision, and that, all those forces and all that energy is applied to the body in different ways. Okay. All right, so non-deployed airbags may deploy during extrication. So this goes back to a scene safety, consideration. So you're having to, cut somebody out of a car. The fire department's cutting somebody out of a car. The mechanism of injury, is a front end collision with significant front end damage, but the airbags didn't deploy. That would be a huge red flag and concern for me. I would be very, very mindful and cautious about the airbags going off during extrication. Maybe the fire department goes about doing something a little bit differently, but be mindful of your safety and others around you and the safety of your patient, okay? Supplemental restraint systems can cause harm, whether used properly or improperly. So in the picture there, you see that is a heck of a seatbelt mark. So, the seatbelt, did its job, but it may have caused, further harm in this instance. So ultimately, you're going to fare way better with these seatbelt marks and staying in the vehicle than you are going through the windshield. So wear your seatbelts. But again, you may see this type of injury pattern in some of your patients, especially, the more significant the mechanism, the higher the rate of speed. There's just things that don't go well no matter how well restrained you are, okay? Rear end crashes, so known to cause whiplash type injuries. So as the body is propelled forward, the head and neck are left behind. Acceleration type injury to the brain is possible. Okay, so this is where you get a lot of people that get whiplash. They also can get concussions. Again, you have to think about the way the energy is exerted on the body here. Okay. Your lateral crashes, so side impact, or we call these T-bone style motor vehicle accidents. Vehicle is usually struck above its center of gravity and rocks away from the side of impact. Okay, so you think about the energy being exerted there and how the vehicle is moving. And then when, the occupants of the vehicle, again, think about all those things in your head, results in the passenger sustaining a lateral whiplash injury. Okay. A lot of the times, the significant T-bone style motor vehicle accidents, you really start to have to worry about things like shearing of the aorta. Seen that a couple times. That's usually a fatal injury. Those patients don't live very long. You can start to get all kinds of cervical spine injuries. You can get internal decapitations. There's lots of different nasty injuries that you can see with these types of crashes, okay? If substantial intrusion into the passenger compartment, suspect lateral chest and abdomen injuries on the side of impact, possible fractures of the lower extremities, pelvis, and ribs, and then organ damage from the third collision. Again, you get a lot of shearing forces in these types of accidents, so you really have to be mindful for those injuries that you cannot see, okay? Rollover and rotational crashes. So rollover crashes, large trucks and SUVs are prone because they have their center of gravity is off, they're top heavy. Injuries depend on whether the passenger was restrained. Ejection or partial ejection is most common life-threatening event. So I'll tell you that being ejected, and if you're in this scenario, in my experience over the years, if you're going to be ejected from the vehicle, you want to be ejected and be clear of the vehicle and just hope that you don't hit something else on your way out. Partial ejections, I've seen that over the years, and that is usually, those patients are usually dead. That is a significant mechanism. You have somebody that partially is ejected, so the bottom half of them stays in the car, the top half of them goes out the windshield or goes out the window, and then their head makes contact with the hood, their head makes contact with the side of the car is rolling over. So you get there and you have a patient that the car is rolled over on the top half of them with the bottom half of them sticking out. It is never a good situation. Wear your seatbelts. Rotational crashes. So spins are conceptually similar to rollovers. Opportunities for the vehicle to strike objects. So you see this a lot in wintertime. So snow and ice on the road. People are traveling too fast. They get into that spinning motion. Next thing you know, they spin off the roadway and into a tree. And you can see some pretty significant mechanisms with these styles of crashes. Okay. Car versus pedestrian. So, the significance of this is going to depend on lots of things. So, type of vehicle involved. Are you dealing with a kid? Are you dealing with an adult? Are you dealing with a geriatric patient? Injuries are often graphic and apparent. Can also have serious unseen injuries. So if you're talking about a kiddo, you think about a kid, where is the impact going to be? Car versus pedestrian. Their head, chest, and abdomen is going to take the brunt of that. An adult, you're going to see more injuries to, the pelvis and lower extremities. Or you may have a multi-systems trauma where they took the impact on their pelvis and lower extremities and were thrown up on the hood. And next thing you know, they've got head injury complicating all their other injuries. Okay, so you have to look at all the factors there. So you should determine the vehicle's speed and whether the patient was thrown through the air. So, what other surfaces might they have made contact with? They get hit at 15 miles an hour and it just threw them into the grass on the sidewalk and they're uninjured. Or did somebody step out into 55-mile-an-hour traffic and, was hit, in the pelvis and their head thumped the hood and then it threw them onto the pavement 20 feet, away. So lots of factors here. Evaluate the vehicle that struck the patient for structural damage. Okay, so, you have vehicle versus pedestrian and the hood of the vehicle is folded up like a tin can. That is extremely significant, or you have, the little bitty plastic piece on the front bumper is broken and that's all the damage there is. Doesn't mean that it's not significant, but those little pieces start to give you a broader view. They start to show you the bigger picture. Okay. Car versus bicycle. So evaluate like a car versus pedestrian. Same things. Okay. You're going to have injuries most time to, if you're dealing with an adult, the pelvis and lower extremities. If you're dealing with a kid, they're going to take the brunt of the injury to the torso and head. Okay. You're going to look at the helmet for damage. You're hoping that they're wearing a helmet. Is the helmet intact? Did the helmet come off? Is it cracked wide open? All those things are going to be important to create the big picture. Those are things you're going to want to relay to the trauma center. So that's important. Spinal stabilization must be initiated and maintained. So car versus pedestrian, car versus bicycle, C-spine precautions need to be high on your priority list. Okay. All right, so car versus motorcycle. So springtime always brings these accidents around. Protection is from helmet or leather or abrasion resistant clothing and boots. So, those folks out there that do all the right things when they're riding, helps them out an awful lot in the event of an accident. It always makes me cringe a bit when you're driving down the road and you see somebody, you get into a different state that doesn't require helmets and they're riding down the highway at 70 miles an hour with no helmet and in flip-flops and shorts. It makes me cringe just because I've seen the nasties of that. So when assessing the scene, look for deformity of the motorcycle, side of the most damage, distance of skid in the road, extent and location of deformity in the helmet. Okay, so if they're wearing a helmet, you need to inspect it. Your trauma center is going to want to know If they're wearing a helmet, what does it look like? I always just take it with me and hand it to them. Say, here was their helmet. Okay. All right, so a head-on crash. So motorcycle strikes another object and stops its forward motion while the rider continues forward in motion. Okay, so a lot of times what you see is, the rider comes up and over the handlebars. A lot of times the femurs get fractured in that process, and then they strike the hood or the windshield. So you've got bilateral femur fractures and a head injury that you're dealing with. So a lot of times these end up in a multi-systems trauma. An angular crash, so motorcycle strikes an object at an angle so that the rider sustains direct crushing injuries to the lower extremities, okay? So I've seen people lose legs from these types of crashes. You get there and they got hit from the side. It's significant enough it pushed the motorcycle and the patient underneath the front of the vehicle. So, they've got an extremity pinned and trapped, so you get crush injuries that they never recover from, and they wind up losing lower extremities from this type of stuff. All right, so ejection. So rider will travel at high speed until stopped by a stationary object. Okay, so sometimes this works out in the motorcycle rider's favor. They're thrown off the motorcycle and they land in the ditch in the grass, and they actually it benefited them. I've had that happen before where motorcycle rider gets hit and it throws them off and they get thrown off into the ditch and they've got just minor scrapes and abrasions and things, and they get up and shake it off and they're fine. Their motorcycle may be totaled because the vehicle continued to run over it, but they didn't get ran over in the process. I've also seen this be really nasty and someone get ejected and then slide down the asphalt at 60 miles an hour, and their skin and face is hamburger with all kinds of airway compromise. So it just very much depends on the situation. A controlled crash. So, this is what they, when folks go and get their motorcycle license and go through courses, this is some of the stuff they hit on is if something's about to go down, this is where they learn techniques to use to separate the rider from the motorcycle. To try to prevent significant injuries. So a lot of your experienced folks, that have rode for a long time and they wear all the right gear, sometimes they can manage to get themselves out of a serious situation just by being experienced riders, okay? All right, so falls. So injury potential depends on the height from which the patient fell. Okay, so it says here more than 20 feet is considered significant. Again, like I said, if you have a child that has fallen, 10 feet, that could be a significant mechanism of injury. You have a, 80-year-old female that is on blood thinners that fell from a standing position and struck her head. That can be significant. So you have to really look at all the factors involved. Okay, so internal injuries pose the greatest threat. Patients who land on their feet may have less severe internal injuries, or they may have shattered their ankles and their tib fib and their femur and their pelvis. Just all depends on the energy, the surface they land on. Do a good assessment, get the whole picture here, okay? Take the following factors into account. So height of the fall, type of surface struck. Again, they land on pavement, they land on concrete, they land on a grassy area or in mud. The surface that they land on can make a significant difference in the energy exerted on the body. Okay, so part of the body that hit first, followed by the path of energy displacement. Okay, so again, this picture here, it shows this patient, falling out of a tree, and looks like her ankles are, are going to make the first contact. Again, I said, depending on how much energy you have that's going to be exerted on the body here, you may end up with ankle fractures, tib fib fractures, femur fractures, pelvic fractures. Do a good physical assessment on these patients, okay? All right, so your penetrating trauma may be caused accidentally by impalement, may be caused intentionally by a weapon. Okay, so you can have a blend here. Somebody gets intentionally stabbed in the chest with a knife and it's still impaled. Okay, so we're going to have to, Again, you have a airway, breathing, circulation, identify life threats. Can that knife be secured in place, or is this patient now in cardiac arrest and I need to do chest compressions and it's going to have to be removed, so depending on the situation, do a good assessment. So with low energy penetrations, injuries are caused by the sharp edges of the object moving through the body. We call this cavitation. Just depends on what you're dealing with. This is, a patient that was shot with a 22 caliber bullet, or is this somebody that was shot with a 45? You have to get all that information and start to put the pieces together. Knives may have been deliberately moved around internally, so to cause more damage. So you get those, stabbings that are just brutal, and usually those, that never fares well. A lot of times those incidents are fatal. By the time we get there, there's not much that we can do, but you run into a circumstance where it was a deliberate stabbing, and they butchered up the inside of them, and there's no telling what kind of injuries they may have. Okay. So the path of the projectile may not be easy to predict. So, I think I may have told my story about the kid that got shot down off of Holden downtown. The entrance wound for him was on his right flank. So it went in just below the rib cage. Bullet went in, bounced around, bounced off the pelvis, and exited through to where he's probably still pooping in a bag to this day. It's a very significant, mechanism. That's just how it works. You never know, with bullets, you just never know where they're going to end up. Okay. Path the projectile takes is its trajectory. So depending on where they're shot, what, solid organs you're dealing with, rib cage, your scapula. There's lots of things that can change the path. You may have an entrance wound, but no exit wound, and you just never know where things are going to end up. Fragmentation will increase damage. So, depending on the type of ammunition, if you're dealing with a shooting, that may tell you how much fragmentation you have. So, trying to find out as much information as you can will be helpful. So I mentioned this. So cavitation can result in serious injury to internal organs. Okay, so this is the path and the trajectory of an object, and this is talking about how much damage and how much havoc it's wreaking as it travels through the body. Okay, how much damage it's causing to tissues. All right, so relationship between distance and severity of injury varies depending on the type of weapon involved. Okay. Drag slows the projectile. Area damaged by projectiles is typically larger than the diameter of the projectile, especially you get some of those bullets that, once they make contact, they open up and spread. You can get significant cavitation. You may have a small entrance wound and a very large exit wound. Okay. Energy available for a bullet to cause damage is more a function of its speed than its mass. Okay, so lots of things go into factor, distance from, the shooter to the patient, the caliber of firearm being used. Are you dealing with a handgun? You're dealing with, a long gun, just lots of factors here. That's why you have to be a good investigator. All right, so this table, it's going to be hard for you folks to see on video. Make sure that you reference this in your book. It's table 24.1. All right, so blast injury. So you have a primary blast injury due entirely to the blast. So I know that Blake mentioned in his lectures about the Boston Marathon bombing, it was a pressure cooker. So, that initial explosion was the primary. Secondary, damage from being struck by flying debris. So those pressure cookers had, all kinds of, things, if I remember correctly, nuts and bolts and all kinds of shrapnel to wreak havoc. So then you start to get, the flying debris, the shrapnel, it can create very significant injuries. A lot of people in that bombing lost extremities due to the shrapnel that wound up being lodged. Your tertiary, so victim is hurled by the force of the explosion. So, you have the initial explosion, you get struck by all the flying debris, and now you're being hurled into a wall or, across the street or wherever. So you've got three, impacts here. All right, so miscellaneous blast injuries, so burns from hot gases or fires started by the blast. So, you can wind up with these patients that wind up with, most of the time it's going to be, in these instances, it's probably going to be a significant burn, second degree, third degree, respiratory injury from inhaling toxic gases or from burn, crush injury from the collapse of buildings. So, someone, they're in a building that is bombed, and they get stuck between falling beam and the floor. They're going to have all kinds of significant injuries. Okay, most patients will have some combination of the four types of injury. Okay, so you're dealing with blasts and explosions. There's never just going to be a single injury, most likely, unless it's just a very minimal. If you're dealing with a large scale incident, blast, explosion, be looking for multi-systems trauma. Okay. All right, so organs that contain air are most susceptible to pressure changes. So a lot of times in explosions and blasts, you see, eardrum rupture. So you'll have people that are bleeding from their ears, and that can be very distracting, but it's just that their eardrums have ruptured. But it's hard as clinicians to say, oh, it's just their eardrums have ruptured. So make sure you're doing a good assessment. Lungs, you can get a pneumothorax, gastrointestinal tract, you can get ruptured bowels. The ear is the most sensitive to blast injuries. Like I said, very, very common at these scenes where you've got these significant blasts to have everyone there, bleeding from the ear because their eardrums have ruptured. Okay. All right, so pulmonary blast injuries result from short range exposure to the detonation of explosives. Again, pneumothorax is a very common, causes, the lung to rupture. Next thing you know, you have, a patient that, can't breathe. Arterial air embolisms can produce disturbances in vision, changes in behavior and state of consciousness, and a variety of neurological signs. I'll tell you, if this is something you're dealing with, the altered mental status is probably going to be your very first indicator that something is wrong here. Okay. Solid organs are relatively protected from shockwave injury, may be injured by secondary missiles or hurled body. Neurological injuries and head trauma are the most common causes of death in these types of incidents. And then traumatic amputations are common. Again, a lot of times that's from the shrapnel that becomes embedded in the extremities and the damage it does to the tissues. Folks wind up losing arms and legs. Okay. All right, so multi-systems trauma, so involves more than one body system: head and spinal trauma, chest and abdominal trauma, chest and multiple extremity trauma. You can get all kinds of different combinations here. Alert medical control and transport rapidly. Again, these are patients where they can be so critical and so severe where you think you're putting out one fire here and the next thing you know, something else catches fire. And you just can't extinguish the fires fast enough for these patients, okay? All right, so some golden principles of pre-hospital trauma care. And I know we've hit on this in one of the other lectures. So your main priority is to ensure your safety, safety of your crew, and safety of the patient, okay? And in that order. Determine the need for additional personnel or equipment. So sometimes you just have to swallow your pride and say, I don't have enough help, I need more help. And then evaluate the mechanism of injury, okay? And again, that's lots of components. You have to do a good scene size up, scene assessment, look at where you're at, look at what's involved, rates of speed, types of injuries that you're seeing. Lots of things go into that. Identify and manage life threats, then focus on patient care. So ABCs, shock therapy, spinal mobilization, transport immediately to the appropriate facility. Okay. Definitive care requires surgical intervention. So definitive care for for the majority of trauma patients is in a surgical suite at a comprehensive trauma center. Okay. So the amount of, if we delay transporting them from the scene, we are delaying them getting to definitive care. So on-scene time should be limited to 10 minutes or less. Okay. So there's times where you just need to say, we need to load and go down the road. Okay. Because they need a surgical suite at a comprehensive trauma center. Obtain a sample history and complete a secondary assessment during transport. If you've got an unresponsive patient, before you leave the scene, you can say, hey, does anybody know anything about them? And try to get some information, but do not delay transport to get your sample. Okay. If you can do it quickly, that's fine. But if you can't, don't worry about it. Just move down the road. Consider ALS intercept or air medical transportation. Okay. All right, so your patient assessment, when a patient has experienced a significant mechanism of injury and is in critical condition, rapidly perform your physical exam. You may have a trauma patient that's so critical you never make it past your primary assessment, okay? Sometimes you don't always make it to that secondary assessment or doing that detailed physical exam, okay? When a patient has experienced a non-significant mechanism of injury, focus on the chief complaint. So, it's something that you don't have a whole lot of concern about, and their chief complaint is my left ankle hurts really bad. Okay, that would probably be where I start my assessment, but make sure that you do a full assessment. Don't miss anything. Don't just let the, oh, my ankle hurts distract you to where you don't think anything else is wrong. Make sure that you're always doing a good systematic assessment on these patients. All right, so injuries to the head. So disability and unseen injury to the brain may occur. Again, we don't have CT scanners in the back of our truck or x-ray vision to be able to see what's going on in there. So you have to be able to, look at the mechanism, are they altered? What's their GCS? What's their vital signs looking like? Or their trends of their vital signs getting kind of iffy? You have to start putting all the pieces together to, create an index of suspicion and say, hey, I think there might be something going on here. Bleeding or swelling inside the skull is often life-threatening. Okay. Include frequent neurological examinations. So if you have a high index of suspicion that this is going on, you need to be reassessing. Some patients will not have obvious signs or symptoms. Okay, so again, not everything is seen. All right. Injuries to the neck and throat, airway problems may result. Look for decap BTLS in the neck region. Swelling may prevent blood flow to the brain. Okay, so we need to, be watching for all this, that, we can't get so, distracted on one thing that we forget to be systematic about the way we reevaluate patients. Penetrating injury may result in air embolism. So, you've got a chest injury, you've got a hole in the chest, and you've got, air sucking in. You need to make sure you get an occlusive dressing on that. Or you have, an injury to the neck with an gaping open air sucking wound. You need to get an occlusive dressing on it. Crushing injury may cause the cartilage of the upper airway and larynx to fracture. Okay, so, I've been witness to a few traumatic injuries over the years where their airway is crushed. I've seen some industrial accidents, have known people that have ran these types of incidents, and airways can become so crushed that we are unable to ventilate, we're unable to oxygenate. You even get to the most dramatic airway measures, surgical cracks and things like that. You can have really significant trauma to the airway structures. And these patients, a lot of times, are going to die on you. It's never a good thing. All right, so injuries to the chest. So the chest contains the heart, lungs, and large blood vessels. Life-threatening injuries may occur, so broken ribs may hinder breathing. Heart may be bruised, large vessels may be torn, get a pneumothorax, open chest wound. So you can see here why lots of things can go wrong real quick, like and in a hurry with trauma to the chest. Okay. Injuries to the abdomen. So the abdomen contains vital organs that require a very high amount of blood flow. Okay. You also, your aorta, comes up out of the top of the heart. makes a hard turn and heads south. So you have your descending aorta that travels through the abdomen. Like we're talking about those lateral crashes, that shearing force. A lot of people get the dissected aorta, and they're going to bleed to death on you. Okay. Solid organs may tear, lacerate, or fracture. So some of the most common solid organ injuries are going to be to the liver and the spleen. So you get a splenic laceration or a liver lac, those things can bleed significantly. You can have a patient bleed out on you. Hollow organs may rupture and leak toxic digestive chemicals. So you get, the bowels rupture, all that stuff is just free floating in the abdomen. That's going to be a nightmare for that patient. It's going to be a nightmare for the trauma surgeon having to do surgery. These people are going to need lots of antibiotics. You're praying they don't become septic. The rupture of large blood vessels can cause serious unseen bleeding. Okay, so I said you got that descending aorta, travels through the belly. This thing ruptures, your patient may bleed out right in front of you, and you may not be able to see it until it's too late. Okay. All right, so management, transport, and destination. So scene time, so survival of critically injured trauma patients is time dependent. So time is of the essence. Like I said, definitive care for trauma patients is in a surgery suite in a comprehensive trauma center, not hanging out on the scene on the side of the road. Limit on scene time to less than 10 minutes. So type of transport. So, that's going to be based on your location. So your distance from your scene to your comprehensive trauma center, is the weather bad, is, all those factors. So ground EMS units are staffed by EMTs and paramedics. So air EMS it may be a good option. It may not be, depends on where you are. There's times where you can put a patient in the truck and move down the road way faster than you can get, air ambulance on scene to transport. So you have to be mindful and make good decisions about that. All right, so our destination selection. So level 1 trauma center is a facility that provides every aspect of trauma care, or we call those a comprehensive center. Level 2 facility provides initial definitive care. A level 3 is a facility that provides assessment, resuscitation, emergency care, and stabilization. So that's going to be very minor trauma, very low mechanism of injury, patients that are stable, they're not presenting with anything that's concerning. You have to make good decisions here. Level 4 facility provides advanced trauma life support. Okay, so those facilities are going to do very, very minimal trauma care. You're probably going to get diverted from those if you try to go there with much of anything. Okay, so here's a good flow sheet. It's in your book. Make sure that you review it. Special considerations, so remain calm. So, you may be the senior person on a scene that's, you've got a significant mechanism of injury, critical patients, you're on a BLS truck, and you may be the most experienced person there. So your ability to remain calm affects everyone else. Okay, so it's a must. Complete an organized assessment. That's why we talk about keeping our skill sheets organized, being systematic, because if you do it the same every time, you stay organized, you hit all the points, you're less likely to miss something. Okay. Correct life-threatening injuries. So address life threats. That's just all there is to it. Do no harm. So do not make things worse. It's one of those, you want to drop people off way better than you found them. Okay. And then never hesitate to contact ALS backup or medical control for guidance. Okay. So if you don't know, or you have a question, call somebody. Okay. It's matters of life and death. We're dealing with human lives. If you don't know, call and ask. Okay. All right. So your review questions, please go through and review these. Okay. I'm not going to review them on video because it doesn't really, there's no good interaction here. So make sure you go through these review questions. Make sure you're doing your quizzes for this chapter. And I'll see you guys next week in class. Have a good night.